Okay, we've already taken care of the things that we would do prior to the procedure. We've informed the patient of what the procedure is going to be. I've washed my hands and removed my jewelry. I've already assembled my supplies. Another thing I've considered too that I probably need to have here is a chaperone, because anytime we deal with procedures similar to this, that we would be best to keep a chaperone available to make sure that our conduct with the procedure is professional. I've also considered the patient's cultural status and diversity, so that I understand their fear or concern about exposure of the genital area for this procedure. And we've settled that, so we're going to move on with the procedure. With the supplies that I've gotten, most catheters will come in a kit. Different manufacturers put different things in their kits, but all kits will have a menu of the ingredients or the contents of the kit. In this case, we have a red rubber catheter, gloves, 2 drapes, cleaning solution, a specimen cup, and a label for the specimen cup. I already know the contents, I know what's in here, and I know the gloves are going to be too small. So I've also went and got myself a second pair of surgical sterile gloves so that I can maintain the sterile contents before I put them into the patient. This is a sterile procedure. We must ensure that we do not introduce any extraneous bacteria into the patient, because chances are they will be back in a couple days with a UTI if we're not careful. I also have my lab request form, because the physician has ordered a test on this particular urine. So I have my lab request form ready to go, so when I get my specimen, I can get it ready and ship off to the lab. Anytime you work with sterile packages, sterile contents, you need to be careful when you open the contents. I've seen that the package has not been insulted. It's good to go. There are no problems with it. So I'm going to open it up. Expiration date is in 2016. Notice I'm not reaching up on top of the container because I don't want to contaminate the inside of the container. As you can see, the contents are arranged. They're not arranged well for us maintaining a sterile technique because the drape is above the gloves. So that's another reason why I have an extra set of gloves. So I'll go ahead and don my first set of gloves so that I can reach into the container and start assembling. Okay, ma'am, I'm going to go ahead and open up the drape so I can expose your genitalia, because I need to get there for the procedure. Are you okay? A little chilly? No? Okay. So I'm going to go ahead and put on my gloves, and I'll let you know what we're doing as we go along here. I'm going to keep this wrapper because I can use it as a secondary sterile field if I need to place anything in there. I'm going to reach into my package so that I can move the package up here. I'll reposition the package here later. But this is the first drape. The first drape has a plastic side and it has a paper side. The plastic side will go down to maintain a water barrier between any spills and the table itself. I kind of roll it over my hands so that I can protect my gloves. Ma'am, if you would, raise up your buttocks. Thank you. And put that down there. These gloves I will not be using at this time, but thinking ahead, if I contaminate these, I've got these available that I can use and continue the procedure. The specimen container is here. Okay, I'm going to go ahead and put it in my secondary sterile field. The second drape is a fenestrated drape. Fenestrated, remember, there's a hole in it so we have an area to work. The drape itself helps us keep our gloves from getting contaminated as we work with the procedure. I have to take this a little bit higher up. I'm using my sterile drape to manipulate the other drape so I can get it out of my way. We have our cleansing solution here. We're going to be using 3 sponges on both the male and the female to prep the area. Just going to tear this off so I can expose my little stick handles. Here's my label for the specimen cup. We also have KY jelly in a package here to lubricate the catheter. Simply going to tear off a corner of that so that I can get a hold of the catheter. When we deal with the catheter, we want to ensure that we hold on to both ends so it doesn't go flopping around and get contaminated. And I'm going to put the tip of it in the KY to prepare it for insertion. Remember, you have to get all this stuff done prior to the procedure, because once the hand is on the genital area, you can no longer use that hand for anything. Try and maintain these two fingers in case I do need something sterile to hang on to something that are available. Alright, ma'am, here we go. I'm going to go ahead and put my hands on your genital area there so I can clean the area. It's going to be a little cold. We're going to wipe it about 3 times. Okay. First wipe will be labia minora right side, going from anterior to posterior. Labia minora left side, anterior to posterior. With the last wipe, going medially over the urinary meatus clitoris, we need to be careful not to fall into the vaginal bowel, and just make sure we clean the medial aspects of the labia minora. And now we're ready to place the catheter. I'm going to get the tray up here close because this will be the reservoir for the urine that is collected. Securing both ends, go ahead and find the urinary meatus, and we can place the catheter. Here you go, ma'am. Yes, I know. Okay, we're going to encounter a sphincter. Sphincters control the movement of fluid out of the bladder. We're going to have our patient bear down like they're having a bowel movement so that the sphincter relaxes. Once it relaxes, there you go, we can advance the catheter. We will hit a second sphincter, and we'll do the same process again. Ma'am, if you'll bear down like you're having a bowel movement. Very good. And we will place the catheter then into the bladder, and the urine will start to flow. Once it's flowing, I can pick up my specimen cup and collect the urine necessary for the sample. Please note that I'm not bumping the catheter on the container edges. I'm trying to keep this as sterile as possible. We're going to collect about 20 to 30 mLs and place the cap back on the container. And we'll continue to drain the bladder as long as we can. Now, depending on how much urine is in here, the bladder is actually decompressing quite rapidly, and the muscles of the bladder may go into spasm and the patient will complain of pain. If that occurs, then you just need to crimp the catheter to stop the flow, to allow the bladder to get used to being smaller. And once the spasms are over and the patient doesn't complain of pain anymore, then you can continue the procedure to completely drain the bladder. Notice I am securing the catheter because we don't want it going back and forth in the patient, because that would help introduce bacteria that we could not eliminate with our wash. Once we start seeing bubbles coming out, we can assume that we're pretty well done cleaning or clearing the bladder. So at this time, we're just going to go ahead and let the patient know that the procedure is over. Ma'am, okay, I think you feel better? Yeah, I bet you do. Okay, what I'm going to do now is pull the catheter out. We'll do it on 3. I'm using my drape as a drip rag so that I don't have urine going into the vagina when I pull out. 1, 2, 3, and with a steady pull, bring it straight out. Keep it confined, otherwise you'll spray urine around. And again, making sure that no urine gets in the urinary or in the vaginal vault. With the urine that's in the container, I will take it in the dirty room and pour it into a graduated beaker or cylinder to get a true measurement of the amount of urine. Because the 3 things that we need to concern ourselves with is the amount, the color, the odor, and the turbidity, which is something we can record when we document our procedure. The specimen then will be labeled. Okay, here you go. Would you like to clean this up, or do you want? Okay. I'll dry it off and then I'll let you finish up. I'll bring you some Kleenex or some toilet paper. Alright? Okie doke. So now with my specimen, I'll make sure that I label the specimen with the patient's information, and that will go on the container itself, and I'll affix my form with the container and put it into the lab box or take it to the lab for analysis.